Hi, I'm Irene, the nurse and exercise physiologist at University Health Fitness Center, located at the Texas Diabetes Institute. In this video series, I'm going to show you some basic resistance and strength training exercises that you can do around the house with items you have at home. Before we get started, here are a few rules that everyone should follow when doing any exercises. Number 1, make sure you have permission from your doctor to begin any exercise program. Number 2, immediately stop any exercise if you begin to feel chest pain, shortness of breath, or sudden pain in any part of your body. You don't need a gym membership to exercise. These are just a few items you may have around the house that you can use during this video. If you have 1 or 2 light dumbbells, great. You can also use a resistance band or 1 or 2 16-ounce bottles of water. As we go through each exercise, I'll demonstrate each movement with these items. I'll also demonstrate modifications for each movement. Keep in mind that form is more important than how much weight you can lift. Also, remember to breathe with each of these movements. We never hold our breath during these types of exercises. Let's work on our legs. If you have any knee or hip issues, please do the modified movements for each exercise, or keep these movements out completely. Using proper form for the squat is very important. I'll start demonstrating without weights or any resistance, using just the chair. Very important to make sure that the chair is behind you. We'll first move as if we're going to be sitting in the chair. The first part of this movement involves unhinging or releasing our hips. As we put our backsides out towards the chair, think about keeping your weight evenly distributed on both feet. As we sit and lower ourselves, we should be about halfway in the seat. Without any momentum from our upper body, we'll press down on our feet, lean forward a bit, and lift ourselves using our legs. If you need to use your hands at first, that's fine, but make sure to focus on your legs to help you up and down. Using our legs, weight evenly distributed on our feet. And I'll show you just a few more before adding resistance. Again, if you need to use your hands, that's okay. Just remember to focus on your legs. I'm going to pick up some dumbbells now and show you how to do this with some resistance. Again, focusing on releasing the hips, you can use the chair. Release your hips, lower yourselves, and then lift, only using our legs if possible without any momentum. Keeping the weights down by the side and keeping the weight evenly distributed on our feet. I'm going to place the dumbbells down and show you how to do this with a resistance band. You can use any kind of resistance band with or without handles, making sure that your feet are completely on the band. You want to grab a little lower on the band close to your feet, placing the weight on your feet as you rise, again, focusing on your legs and not any momentum that you may have and use as you come up and out of the chair. And then one more, and we sit back down and rest. You may want to start by doing 1 set of 10 repetitions. Now I'll demonstrate the lunge. First, remember that if you have any knee or hip issues, you may want to modify and or keep this movement out completely. Using proper form for the lunge is very important. Let me show you. Stepping forward with your front foot, bending at the knees and hip, lowering yourself as far as you comfortably can. You would like to get 90 degrees. Raising, stepping back, and alternating. Keeping the knee in line with the toe, weight on the front foot. Step forward with 1 foot, keeping your upper body straight as if you have cups of water resting on your shoulders. Bending at the knees and hips, lower yourself slowly as far as you can while keeping yourself upright. As you lower yourself, keep your weight evenly distributed on your front foot between your heel and midfoot. Your knees should be pointing in the direction of the big and second toe. When you stand, you would step back and then again step forward, keeping the knees aligned, weight evenly distributed, upper body straight. Keep continuing to do this movement without weights until you are more comfortable. If you need a chair for balance, that's fine. Do not put all your weight on your hand with the chair. Let's pick up some dumbbells. Holding them by your side, same movement. Step forward, lower, as low as you can. Keep your upper body straight. Step back, change legs. Remember to keep your knees in line and the weight evenly distributed on your front foot. You will do these reps 10 times. Let's pick up the water bottles. Same concept as the dumbbells. Holding them down by your side, lowering yourself, bending at the knees and hips, keeping your weight evenly distributed across the front foot, and keeping your upper body straight. Using a resistance band, you'll start with your foot forward, stepping on the band, pulling up on the band, bending at the knee, and standing. You'll keep your foot on the band and will not take this back. You will do your reps 3 to 5 times. Changing legs, remembering to keep your foot on the band, and again, lowering and lifting, same principles, upper body straight, cups of water on your shoulder, and bending only as far as you can. Remembering to use good form is very important when doing the lunge. Strength training is an important part of our wellness and fitness. It's not about creating muscles that make you look like a bodybuilder. It's about building muscles that will help you with your day-to-day responsibilities, like lifting a laundry basket or putting cans away in a pantry, or even getting up and out of a chair or off a commode. It helps improve our balance and it can increase our metabolism. Remember to breathe with each movement. Never hold your breath. Do these exercises 2 to 3 days a week, never 2 days in a row. Focus first on good form, then adding weight or resistance. Again, remember to check with your provider before beginning any exercise program and stop if you have chest pain, shortness of breath, dizziness, or sudden pain in any part of your body. Thank you and be well.